Gauteng Health MEC Nomantu Nkomo-Ralehoko says as the department, they are making all they can to improve infrastructure in their healthcare facilities. Nkomo-Ralehoko held a media briefing at Mamelodi Regional Hospital in Pretoria yesterday, where they also showcased their new wards and improved infrastructure in that particular hospital. Meanwhile, Helen Joseph Hospital has been trending for all the wrong reasons in the past week. Its acting CEO has debunked claims by a Chiawelo family that the hospital buried their matriarch as a pauper without actually informing them. Now, this follows the airing of a story where the family of the late Maphefo Priscilla Masilo sought assistance to exhume and rebury their loved one from the hospital and the provincial department to assist them in the exhumation and reburial of their loved one. Health activist Dr. Kgosi Letlape joins us now to weigh in on the update from the Department of Health here in Gauteng regarding issues at Helen Joseph. Thank you so much for your time as always, Doctor. Welcome. So the Gauteng Health Department admitting it neglected certain protocols in the handling of the deceased body as shown in a video by Tom London. But at the same time, Doctor, defending their conduct. Is this even acceptable in your view?
Good afternoon to you and good afternoon to the viewers. It would be the detail of which aspect of their conduct are they defending. But what we also be mindful of is the invasion of privacy for the deceased, even though they're not here, in terms of being shown on social media without permission, without the family's consent. And what is even more alarming is that these matters are not being brought to the attention of the authorities for the first time. There have been formal reports. We've had the previous Ombud, Professor Makgoba, report on the Rahima Musa Hospital. We still have to see any comprehensive efforts in terms of dealing with the issues that were raised. And it's just quite alarming that we'd have to wait for someone that goes to social media to stand up. When medical practitioners report these issues to the authorities or go to the press, they get disciplined, they get threatened with dismissal. So we just want to see the ministry taking this complaint seriously.
Absolutely, Doctor. I mean, the other critical aspect of this matter raised is, of course, the issue of staff attitudes and the Batupile policy that is seemingly synonymous with most public service departments, not just hospitals. And at a time when we are currently observing Public Service Month, what do you think still needs to be done to address this very critical aspect, you think, Doctor?
I think there are multiple factors. The strained environment, working environment, and the issues of being overworked come to play. The issues of duty rosters, the issues of insufficient staff. What would be interesting would be to know from them what is the percentage of funded but unfilled posts, and what's the gap between required posts and unfunded posts. One of the problems that nobody can justify any patient being treated badly. And we need adequately trained professionals that issues of their work environment should not be taken out on patients. That's unethical, that's unprofessional, that's unacceptable. But at the same time, we need to ensure that professional health workers work in a professional environment that is conducive for them to be able to do the best for their patients.
And infrastructure, Doctor, was also at the core of this matter. And we know it's not just Helen Joseph. You mentioned Rahima Musa. There have been shocking videos of ceilings falling on patients because of leaking roofs, and at hospitals like Bara, maternity hospitals, where we get reports of illegal or undocumented foreigners overcrowding services. Now, this type of behavior seemingly is widespread. So where else should the department, even from national level, specifically focus, you think, not just addressing surface issues, but digging deeper to the root of the problems?
We need a systems review. Firstly, health should become a national competence, so that when the public goes to the Minister of Health, the Minister is able to give answers without talking about concurrency. Secondly, at an institutional level, you need more powers given to competent, ethical CEOs that have the skills. every institution should have a locally maintained maintenance budget. Every institution should have a maintenance office. When you have a small tap leak, you shouldn't be doing a requisition to public service to fix that. You should have the ability as a CEO to have staff on site that have the resources and the materials needed to do minor maintenance of equipment and infrastructure. Without doing that, it's a tedious process to be waiting for people outside. Remember the great difficulty that we had in restoring Charlotte Maxeke Hospital after the fire. Then you had the National Department coming to intervene to help so that that can happen. We need more responsibility, more devolution of powers, and more resources to be made available to the local administration that is capable and adequate for the tasks.
Mm-hmm. Doctor, now we know that, of course, the president has said he will halt the implementation of the NHI at this stage for further consultation. Do you think this points to broader matters that the bill in its current form is not ready to be implemented or addressed at this stage?
I think it points to willingness to engage, but more importantly, as some of us have always been saying, we define a problem and we come with a solution that is not appropriate to the problem. When you listen to the minister, he will eloquently talk about the budgets that we have in public healthcare services through the budgets allocated to the Ministry of Health and the provincial departments of health. He will then also talk about the amounts of money that is in the medical aid pot and would clearly articulate that we're spending between 8 and 9% of GDP on health, but our outcomes are not close to what they should be. What you should then focus on is how to ensure that we get value for the money that we spend, not to create an extra pot of money. That is inappropriate. So once you fix the ills in the public healthcare system, once you fix the challenges in the medical aid system, then if it is necessary and you are a proper steward for the finances that you have, you can then ask for more money based on appropriate requests where we see that the money that you have, you are utilizing appropriately. There's no wastage, there's no corruption, there's no BE-related unrealistic procurement where you are overpaying for equipment and for goods. There's no wastage of administration inside the private sector and medical aid system, and that you begin to say people on medical aid should have surety about services that they're going to have. They should know what they covered for, and there should be no co-payments for universal health coverage. Once you do that, and you are fixing the public healthcare system, then you are on your way to a working health system. The other issue that needs to be realized, we will always quote the Freedom Charter as South Africa belonging to all those who live in it. It's about time we define that refers to citizens. All right. And for those that are not citizens, we apply international laws in terms of what they can access, what they should pay for, and they will not be denied emergency care. But what we cannot do is let people that are not emergencies clog our public health care system.
All right, Doc. All right.
When it is qualified.
All right, Doctor, I know you and I can go on and on this matter pertaining to the NHI, but unfortunately, I'm out of time. Thank you so much for your insights, as always, Doctor. That is Dr. Kgosi Letlape, the health activist on the Department of Health, there, briefing on Helen Joseph.